On this edition of Gray Matter, we're going to be talking about humoral theory and bloodletting. As early as Hippocrates in the 5th century BC, doctors believed that the body was composed of 4 humors or fluids. These humors were blood, phlegm, yellow bile, and black bile. They were also associated with the 4 elements of earth, air, water, and fire. These humors, when in balance, were believed to create a healthy person of mind and body. However, when these humors were knocked off balance, one would become sickly. The best way to cure this, doctors believed, was to relieve the body of some of its ill humors. One way to do this was bloodletting. I have some instruments in front of me that were used for bloodletting. One of them here is called a Flea. You open it up like this, and there are 3 different blades in the Flea. You have small for children, medium for adults, and large for livestock. You would take the appropriate size blade, place it against the arm, and hit this end with a little wooden mallet, which would cut a notch into the skin. Then the arm would be held over this bleeding bowl to collect the blood. Bloodletting was prescribed copiously to the point where sometimes the patient would even pass out. Another instrument that was very popular for bloodletting was this little thing here called a Scarificator. If you look on the bottom of it, you'll notice that there are 10 slits, and within each slit is a spring-loaded blade. One doctor would cock this hammer back, and it would spring-load the blades, place it against the arm, and push this button, which would release the springs. Each blade would come down and cut a small notch into the arm. This was believed to be the more humane way to do it, although I have my doubts. And finally, we have leeches. Leeches were popularized by French physician Francois Broussais. Leeches were placed on many parts of the body to cure a variety of ails. These leeches were placed on the skin and would begin sucking the blood. Leeches have a bit of an anticoagulant in their saliva, so when they latch on, the blood continues to flow without clotting. They also have an anesthetic in their saliva, which means it's very painless when they bite. They only take about an ounce or so of blood before they get full and fall off. The use of leeches in medicine were persisted until the 1950s, but they are making a bit of a resurgence today in microsurgery. A huge advocate of bleeding was Dr. Benjamin Rush, who is a founder of our College of Physicians of Philadelphia. He used bloodletting as a cure for yellow fever during the outbreak of 1793. Unfortunately, most of his patients did not make it. If you're interested in learning more about humoral theory and bloodletting, please visit the Mütter Museum to see our brand new exhibit, Going Viral. And if you're a teacher and you like what you see, why not bring your class down to the Mütter Museum for one of our interesting and engaging Mütter lessons?